Welcome to the Partners in Health webinar, and today's webinar is titled The Role of Nursing in a Global Pandemic. I'm Leslie Friday. I'm a member of the Marketing and Communications team here, and my title is Director of Content. So I am very excited today to be speaking with some expert nurses at Partners in Health, and I'll introduce them in 1 second here. But real quickly, we have Cory McMahon, Dr. John Welch, and Marc Julmisse, all three expert nurses in their fields. So a little housekeeping, I think, to get us started. I want to make sure that everybody has a good experience when they're watching this webinar, and maybe a lot of us are already accustomed to Zoom. I know we are now living on Zoom quite a bit, but if you haven't used this very much, you can go up to the view options, and if you click there, we've decided that the best experience is the side-by-side mode. So make sure that you've got that clicked, and then we will be presenting PowerPoint. So if you want the best view there, you'll see kind of in between the view of the speakers and the PowerPoint, there's a little bar, so you can slide that back and forth to increase the size if you can't quite see the images and text very well. So that's our little intro. And again, thanks to Cory, John, and Marc. And I'll introduce each of them, and then they will give about 5 to 7 minutes of talk in their area of expertise. And then afterwards, we'll open it up for a Q&A session. And we do have some great pre-submitted questions, but please feel free to submit questions yourself. You'll see, if you look at the bottom of the screen, there's a Q&A section, so you can just click there and enter your question. And we have folks sorting through the questions and feeding them to our participants here. You can also just chat with each other, so there's the chat option. But without further ado, I want to introduce our wonderful guests here. So we have Cory McMahon, and Cory is PIH's Director of Nursing and Midwifery. Welcome, Cory. We have Dr. John Welch, and he's PIH's Director of Partnership and Operations for Massachusetts COVID response. And he's also at Boston Children's Hospital as the Senior Nurse Anesthetist and Pediatric Nurse Anesthesia Fellowship Director. And Marc Julmisse, who's currently in Haiti right now, and she is working with Zami La Santé, as Partners in Health is known in Haiti, as the Deputy Director of Quality Programs, Standardization of Hospital Care, Odontology, and Oncology. So welcome to all three of you. And I think what I'll do is just hand it over to Cory here, and she'll kick off our presentation. Again, thanks everyone for joining.
Thank you, Leslie, and thank you everyone for joining today. Really, I have to just start off by giving a very heartfelt thank you to my friends and colleagues and nurses and midwives everywhere who are really stepping up in countless ways during this time in very challenging circumstances. And so with that, kind of 2020 is the year of the nurse and midwife, and usually this time of year, yesterday we recognized the International Day of the Midwife. And this today launches Nurses Week, leading up to the 200th anniversary of Florence Nightingale next week. And this is usually a time of celebration for nurses. And I think it's a little bit different this year, but certainly a time to recognize the incredible role and work that nurses are playing in very different settings around the world, and in order to meet patient care needs and really stop COVID at this time. And so I'm going to spend a little bit of time, and it won't be too long, talking about Florence Nightingale, because I think it is so many of the lessons ring true. She really was the pioneer of modern day nursing and went to the forefront of the Crimean War and served in a hospital there. And it was the basic principles of compassionate, patient care and infection control measures and hygiene. And, she set up a laundry system and opened the windows for ventilation and was able to decrease the mortality rate by over 50%. And so when we think about that today in these times that we're currently in, you know, it's those principles of compassionate patient care, of the infection control measures, and of data collection to drive practice, which she was also kind of the pioneer of. And so I think that rings true more than ever and is something that we are all integrating into our practice today. Next slide, please. So this is exciting. The State of the World Nursing Report came out just about a month ago and really showed the vast nursing and midwifery workforce around the world. 191 countries out of 195 participated in this, and this was the first snapshot at a global level of the nursing workforce around the world. So we know that, you know, nurses account for, you know, close to 59% of the health professions. And I think that really speaks to that how important it is, because nurses are often the linkage into the healthcare system and the care connectors for patients, linking them into healthcare. And so as we talk about the need for universal healthcare now more than ever, the role of nurses and midwives in this is so critical. And I think that, you know, COVID-19 has certainly brought to the forefront the need for mental health support, not only for patients, but for our healthcare providers. When we talk about non-communicable diseases or chronic care that we need, you know, how are we meeting patients' needs, whether they have COVID or do not, making sure that our patients are getting the medications and the care that they need on a daily basis. And I think, you know, nurses are contributing in countless ways as we talk about patient and healthcare worker safety, you know, health systems, and really delivering this integrated patient-centered care. Next slide. So this was a photo pre-COVID. There's no social distancing here going on, but I like this photo because I think that it highlights that, you know, nurses and midwives are certainly getting some well-deserved recognition in the media today for the incredible work that they're doing. But this is a role that they have been playing at all times, is kind of this care coordination piece and linking people into care and being that compassionate provider and that systems leader and being an integral member of a multidisciplinary team. And so this is a nurse and a physician who lead our MDR TB work in Lesotho, and they're constantly thinking about what are all the care components that go into patient care and making sure the patient needs are met. Next slide. So a quick overview of nursing at Partners in Health. Over half of our clinical staff are nurses and midwives. 75% of the clinical care is delivered by nurses, and over 90% of nursing and midwifery staff are female. So I think you know, what I want to point out quickly is that the 75% of clinical care is delivered by nurses, again, brings back that nurses are often the first point of entry into the healthcare system and how important it is kind of linking into that system. And sometimes they're alone in some very rural settings. And so they're kind of having them in these places is so important. And the gender piece, I think, presents a unique challenge, because we also know that our nurses and midwives are also the primary caregivers when they go home. And so they're facing unique challenges both at home and also at work right now. Next slide, please. So nursing is a thread that binds. So, you know, I think I've emphasized this a little bit, but nurses are the care connectors, the systems leaders, patient advocates, and innovators. And you're going to hear shortly from my colleague John and Marc, and certainly can highlight some of the care connection pieces and systems leadership. I know John has, you know, really been leading some of our contact tracing efforts across Massachusetts. And Marc has shared some patient advocate stories and the incredible innovative spirit amongst our nursing and our medical staff really coming together to create some very creative solutions despite limited resources. And I love this quote here that nurses are naturally cultivators of grit, and grit being a combination of passion and perseverance. And I think Marc shared yesterday with me a story about a few of her nurses being the first ones to want to jump in and offering themselves to the COVID treatment unit in Haiti, while also expressing that despite their fear, that they are a nurse first and foremost, and that is what's most important at this time, that they don't stop becoming a nurse just because of COVID-19. And I think that really showcases this idea of grit. And then next slide. And then the last piece I just want to say before passing this off to John is, now more than ever, I think that we're highlighting the need for this human contact and relational approach to nursing care. And you see here, this is a nurse caring for a newborn and she's not in PPE, but nurses and midwives now are facing the challenge of wearing full PPE in a disease that is very isolating, and they have to overcome some incredible challenges. And so it's this human contact and empathic piece that I think is more critical than ever and is certainly being highlighted. So with that, I'm going to pass the torch to John.
Thanks so much, Cory. And good afternoon, everybody. Thanks for spending some time with us. We're really excited to be with you and highlight the role of nurses at Partners in Health around the world. So my experience with Partners in Health started in Haiti and then expanded to West Africa during the Ebola response. And now I'm fascinated by the fact that the lessons that we've learned all around the world for the last 4 decades almost, we're employing here in Massachusetts. And, the link to all of that, those lessons are primarily lessons from our nurses. And what it says here is absolutely true. Nurses are the care connectors. It's no mistake that the leader of our West African Ebola response, Dr. Sheila Davis, is a nurse. It's no mistake that she's now our CEO. It's not a mistake that someone like Marc Julmisse is such a strong, powerful leader at the hospital in Mirebalais, and so well respected all around Haiti. And I guess my hat's off to Cory for being our nursing director and taking us all down this path to connect each other. And this idea of nurses being the connectors, particularly in crisis, is one that we're seeing now. The COVID response has been one that's required heavy nursing care. And just like with Ebola, and just like with so many other major crises that we see, the burden falls on the shoulders of the caregivers. And as Cory mentioned, so many of the caregivers, first-line caregivers, are nurses. That's because, over decades, we've fought for a seat at the table. And by having a seat at that table, we've been able to share the nursing voice. And we all know that the nursing voice is really the voice of our patients. So I think that's one of the most important things that we bring, particularly during COVID right now. With our Massachusetts work, we are working very closely with the local boards of health, with community health workers, and with this role that we're calling care resource coordinators. And their job is really to take anyone that we get on the phone who may have contracted COVID or been in contact with a COVID case to connect them back to the resources that exist in their communities. And oftentimes we're finding that what that means is that they're connecting them back to the nurses in their communities who can provide those critical social services. We can go to the next slide. So this is me and one of our patients. So I'll just tell you a quick story about this picture. This is from a place called Sambuya in Sierra Leone, and it was pretty early in the morning. I had been stationed in Sierra Leone only a few days. I had been primarily working in Liberia when there was a knock at my door, and I opened the door, and it was Sheila Davis, my bedroom door, and it was Sheila Davis, who I knew she was coming from Liberia to Sierra Leone, but I didn't know she was there yet. And she said, I just got a call from WHO, and they need our help in Sambuya. And so, myself and Katie Barron, who's a nurse practitioner who worked with us. She was our nursing director for Ebola in Sierra Leone. And Sheila Davis, who was the chief of the entire West Africa response and now our CEO. We got into a van and we drove to Sambuya, and we put on our PPE, and together with the staff at that small Ebola treatment unit, which is what you're seeing here, that it was a school that was repurposed for Ebola care, which was very common at the time in West Africa. We worked together for hours to triage folks, to get them into ambulances and sent to our larger Ebola treatment unit that had a much higher level of care. We all knew each other's nursing strengths, and so we all played to those strengths and helped each other out, and worked for hours at Sambuya to try and triage those patients, get them to the care that they needed. And this to me just shows the incredible depth and breadth of what nurses offer. I mean, here Sheila was leading the response in 2 countries, but also able to put on her PPE and jump in and take care of people. And I think this is the value of nurses in an emergency, in an epidemic, in a pandemic, and that's what we're seeing right now. This gentleman that you see here, he was actually an employee. He was, I believe, a sprayer. So we had people in the Ebola treatment unit who had those backpacks of chlorine spray, and his job was to spray to try and keep us safe and try and reduce the amount of Ebola virus that was around. And we found him extremely ill. I was very afraid that he was going to die. And we put him in an ambulance and made a phone call to our main Ebola treatment unit in Port Loco. And, he fought like hell. And sorry. So this picture is really touching. I haven't seen this picture in a while since we reviewed these slides today. And it's great to think of being able to not just be a nursing leader in West Africa, but also to be a nursing provider, and to have been part in helping him out so that he could get well again. And he went right back to work once he was well enough. So it highlights the power of nurses working at all levels. And I think that those nurses on this call will agree that we work hard to keep our skills current, and at least our licensure current, so that when we need to, we can jump in and help out. We can go to the next slide. The picture that you're seeing here is the first night in West Africa, in Sierra Leone, when our Ebola treatment unit was open 24 hours. You know, it was a strange time when we started working there, in that there was so much work to be done and so few people, and not great systems in place. And one of the things that became very clear to us was that because of problems with generators and electricity, staffing and all of that, that keeping an Ebola treatment unit functioning to accept new patients through the middle of the night was a real challenge. And you know, as soon as I arrived and realized that we weren't able to do that, that became my first goal. And so what you're seeing here is not only one of the first days that we instituted a new triage protocol that was really driven by our nurses, but also the first night that we opened to accept patients 24 hours a day, 7 days a week. And I have another picture that's not on this slide deck, but a picture of the ambulances lined up outside of our Ebola treatment unit to bring us patients throughout the middle of the night. So, and I'll just highlight that was, you know, an urgent need that was really highlighted by nurses. And so I think one of our most important roles when we're not working abroad or working in the fields is to bear witness to the lives that we have been able to touch and those that we haven't been able to touch, but who need us. And, you know, when I think about this and talk about this to other folks, I think of a story that I read of an Arctic explorer who said, you know, when he's in the Arctic going through really tough situations where he's alone and it's cold and it's windy and things are terrible, the only thing he can think of is being home and having a nice glass of wine and being with his family. And when he's home, having a nice glass of wine, relaxing with his family, the only thing he can think of is being in the Arctic, doing this exploration. And I would say, you know, I echo that very much. You know, when I'm not in the thick of it, trying to do my best to do this work, I'm spending a lot of time thinking about it and sharing the stories and bearing witness to the lives that I've been able to be a part of. And really, this is one of the most important and, as it says here, sacred roles of us as nurses. And that is to be a collective voice of the people around the world who need us. Next slide. And finally, I don't think this is a surprise to anyone before I pass it to Marc, but nurse is the glue of, nursing is the glue of the public health system. When we think of the major pillars of a public health response, that's testing, contact tracing, treatment, safe isolation, and support. And I don't have to spell out for each one of those various pillars how important it is that nurses be there to guide those various pillars, but also back to what Cory said, be that tie that binds them all together. You know, it is very important in a pandemic, in an emergency response, to have these very clear pillars of responsibility. But I would just say that the foundation on which those pillars sit is nursing. And, you know, the thing that those pillars are supporting is a public health system. And so it's an honor to be, again, representing Partners in Health in a public health response as a nurse. And it's been a real privilege to speak to now well over 100 public health nurses from across the state of Massachusetts to understand what their unique needs are at the local level and how Partners in Health can be there to respond. So thanks for listening and letting me share my stories. And I'll pass it over now to Marc.
Hi. Hi, everybody. I had promised the team that I would not have any technical difficulties, but I started to see the screen freeze a little bit. I promise. I am not going to hang up on the call, or try my best. Thank you so much for giving me the opportunity to share. If you hear some background noise, I'm actually at the hospital, so there might be some noises going through, so excuse me for that. And I do want to say thank you so much for giving me an opportunity to come out of my mask for a day or for an hour or so. It feels good to breathe beyond a little N95. Just to explain just a little bit, I am in Mirebalais Hospital right now in Haiti, and we have had, we are one of the first sites in Haiti that received COVID cases. And I want to talk a little bit about the nursing response and really how this, how COVID actually has seemed to do something that we've been working towards. We talked a lot, and John mentioned a little bit about, we talked about nurses having a seat at the table. One thing I've noticed that COVID has done has eliminated some of the silos so that we became more of a team. So that there wasn't a discussion, should a nurse be here? It was automatically who's on the team and who needs to be here. A while ago, somebody said to me, the person closest to the bedside is the person that has the most information. If I'm at the bedside, this is why it's so important. I think in the face of COVID and this global pandemic, that it's so important that now those at the bedside are also have a seat at the table to speak about or to advocate, not just on the patient side, but advocate as far as what do we need to do for our own protection and the protection of our patients and their families and so forth. And one thing we did talk about is nurses as leaders and innovators. And I will tell you, and you might have seen in many of the reports coming out on the news and so forth, there are so many innovators right now. I call it our MacGyver season or the MacGyver spirit. And we've seen that so much more now, where with the lack of PPE, personal protective equipment, with the lack of resources or the limitation, I could say, of some resources that we have, you are now forced to become that MacGyver and identify how do we best protect our patients, but how do we best protect ourselves? So Cory had mentioned earlier that about 51% of our clinical staff are nurses. 75% of the care that's delivered is delivered by nurses. This means we are at the forefront. We are a majority of the front line, and we are a majority that are at risk. Earlier today, one of our colleagues had shared in one of the countries that we work in that the amount of people that were infected, that are working in the COVID units that were infected by COVID-19, majority was nurses. And in knowing this, knowing the risk that's present, I have to say that when we first got our COVID cases, or we said that we need people, put the call out for people to come in and give care or to work in our COVID units, the first group that came through were nurses. And my first question, because we just don't want bodies, you want to know, like, are you okay? Mentally, are you okay? And he said, I'm scared, but that's why I'm a nurse. That doesn't change it, because if I don't do it, then who else will? And you almost got the mama tears coming down your eyes, but you have to like hold it in. So like it made me proud at this point, because it felt like we are together. There's this protection, this group that says we're going to stand in the gap so that we are here to protect our patients. We're not going to step back from this challenge. And that's a spirit that have been echoed, and some of my physician colleagues here has actually commented on that and actually said some words of encouragement to our team, which I appreciated, to say that they appreciate the fact that they are some of the first people that step forward. Let's go to the next slide. One thing, and I said a little bit, nurses are innovators, and we are leaders, and we are very system thinkers, even though I can't speak right now. I think the nerves are getting. We are very system thinkers. And one thing, as soon as we knew that COVID started really ravaging our neighbors really close by to the United States, and the first case that came out in the Dominican Republic, the first question is, what do we need to do? And how quickly do we need to put it together in order to start getting ourselves ready to address what is going to come to us, not what we hope will not be coming to us, but what will come to us. Immediately, as a team, we came back together, and I said earlier that this is one thing that I've noticed about COVID, the COVID-19, is that where other places that you have to say, where's the nurse, or who else is at the table, or have to struggle to get to this table, this is where we've seen on the clinical point where now this team has to protect our patients, but also have to protect ourselves. It's saying, let's work together. There's no labels, there's no hierarchies. We are now working to identify how we're going to address this pandemic. And now it became not titles, it became who is essential at this table. And the majority at this point, from different points, from the external clinic, people that are working in the community, people that are working in maternity, our people that are working in our NCD, non-communicable disease, people that are on the front line saying they need to be at that table, because now we have to talk about how we're going to develop a plan, staff, systems, space, patient support, and now protection also for both our patients, our staff, and the parents, the families that are coming through. So immediately we formed a several task force. We have a clinical task force. We formed a epidemiology task force, which is actually led by one of our nurses. We formed a task force that's looking at operations, and the other part, and also communicated to other teams about setting up different COVID units, as saying we need, if plan A, which is using the hospital facilities that we have set up, and then we are bombarded with patients, what is plan B? Now we have to set up COVID units. And the amazing thing is, when the designs were being discussed, they included those that were closest to the bedside in the discussion, because now we're looking at the flow and said, this is an issue that might cause risk to ourselves and our patients. This flow design might not work. Have you thought about this? So in this way, we became partners, true partners in health, if you're thinking about it, because now operation became partners with clinic. Right now, what we have, which is amazing, and we could go to the next slide. I want to show you this. This is our first team. It's 2 of our physicians and 2 of our nurses. That's the first team that started working in our COVID unit. And it literally was one person looking after each other. Are you dressed appropriately? Have you put on your PPE appropriately? When we decontaminated, are you decontaminating appropriately? When we had a question about a unit or about the flow, we worked together and said, this flow doesn't work, or we have a question about the patient. There's a discussion together. We have a question about the system. We sit together. We have 2 of our, we have one of our nurses and one of our physicians that's leading out our pre-screening, our first and primary and our secondary screening. And I can tell you, every day when I see them, it's together. Every time there's a discussion, it's them together. This has become where we actually became a team, and what clinical care should be, rather than us working silos on the clinical aspect. Going back, our core components, what we've done in responding to this as a team, and I have to keep going back to that, because that's the important part when we're talking about interdisciplinary care, or we're talking about protecting our patient. It's not just one profession, it's us together working, and not one person on the outside or one group on the outside. Our rapid response clinical team is an interdisciplinary team. When we discuss patient flow, it was together. When we discuss patient safety, and that's a continuous discussion every day. Yesterday, I had a talk with our midwives, which is hard, because one of the pictures, Cory, you showed earlier, where you had one of the nurses looking at evaluating a mother without her PPE on. And now the midwives are saying the mothers now don't have, their families are not able to be with them. I'm dressed in full garb, so they can't connect with us. So now the mothers are starting to feel a disconnect. And it's our nurses that that actually had brought up and said, how are we going to address the mental health aspect of our mothers that are delivering? Because this is, to them, it's a hard, it's a difficult time. They are fearful for themselves, they're fearful for their babies, and they can't connect with us, because now we have to protect ourselves too, and we're in this garb that they can't really do that eye contact where they had before. They can't see that smile of encouragement on your face if you're trying to do that, because they can't see anything except this going out. so we are looking at how are we looking at staff safety? How are we going back to staff safety, sorry. One thing too is sometimes the patient's in need of contact, they would try to grab onto the staff in order to have some physical contact. Now they're saying like, we need to find a way of encouraging and working with the patients so that they're not putting the clinicians at risk, our midwives at risk, but how do we still comfort them, but keep a distance? So that was the question, one of the discussions that we have that we're going to bring back to the team so that we can find a solution that will provide care for the patients, but also provide safety for our clinicians. And John really spoke a lot about community engagement. We are, as a point of protection, we had literally when we first heard about the first case of COVID that came out, our ICU nurses, about 3 of them post-shift, came to my office and said, we need to talk about how we're going to go into community and start talking to people about COVID and what they need to do and what protections. And I was like, okay, I can meet with you at 10 o'clock. Stayed after they got off their shift at 7 a.m., waited to 10 a.m. for us to sit down and said, can we go out today? This is the materials I need, A, B, C. I was like, okay, who's going to pay for this? So they were like, well, we can all give our little bit of, because before we didn't develop a plan. So we're like, we need to get this out. So immediately they're like, we're willing to give our money right now to start it today, right now. We want to go out right now after our shift. And that showed you that this is because they realized the need for community engagement, the need to speak to the community, and then they wanted to do it face to face so people understood that I am your clinician. I'm not this invisible wall or this person that you don't know, this non-entity, but I am your clinician. So if I'm the one taking care of you in the hospital and I'm also the one going into the community and speaking with you, maybe we can have a connection. So they wanted to have a closer connection to the community. And that is an amazing part of what I saw and what I continue seeing coming out of our team in response to COVID, and really in response to a lot of the situations that are coming out or the innovations that we have to do in order to provide care for our patients. We are natural advocates. What I do like now, and I have to keep going back with this, is I love the fact that as a natural advocate, now we are working together closer with our other colleagues to identify solutions in this MacGyver spirit to provide care for our patients. That in the COVID unit and those patients that will be affected by COVID, even though they have never fallen ill with COVID-19. Those that care could be ignored because we're focusing on one illness, and then the risk is to have an increased mortality, people getting and morbidity, death or injury for those that are non-COVID related death injury. So our team is looking at both aspects of that, and I could say that on a daily basis, we're continuing to bring these points up to address it. I apologize if I'm going really fast, but I really want to get to the point where we can get your questions. Next slide. I promise it's the last slide. This is some of our team at the border. We're receiving upwards about 300 patients coming through the border of the Dominican Republic into Haiti on a daily basis. And the team had set up a primary and secondary screening. This is one way to show you that I could say that, and I feel like I'm being repetitive, and I hate to say that, but I want to keep saying that as we all realize the importance that it's not about working in one group, doing the job. It's about working together to address the needs that are affecting our community and affecting us. I think that is one more thing, and I say I did promise my last 2 slides. We could go to the next slide. This is one of the images now that this is how now we're treating our patients rather than being very close to them. We have somewhat of a distance that we need to hold. And this is us. This is a modified guard, I should say, not full PPE. This isn't our regular pediatric clinic. This is one of our nurse practitioners that's examining our patient. As leaders, and to make sure that we are training that next generation, as we're working, as my team is working in the COVID unit, as my team is working on working together with the team to develop policies and protocols and patient flows and so forth. If you go to the next slide, we have Nightingale nurse leaders, which I am proud to say that these people, these 4 nurses that have gone through this Nightingale nurse leadership, executive nurse leadership, are part of those people that are now at that table leading out the efforts in providing care for our patients in their sites and leading out in COVID efforts. I think this is one of the big things for us as nurses, is not just to do, it's really, I think it's investing in that leadership and investing in, I don't want to say those coming behind us, because I don't think we ever leave as nurses, right? We're always there. Constantly investing in those, in the knowledge that we have in our sites, in the knowledge of nurses, in the ability that we have all over. And I don't want to keep running on, but I would say Graciela Cade, we have now, is working directly supervising the COVID unit. Ms. Charles is helping us in the middle, also is assisting us in developing policies and protocols on what we need to do that are for our context here. And these are ways that our team continues to help support the COVID effort that we are doing here in Haiti. Sorry. That's it.
You did a great job, Mark. I love it. I love your energy. This is Leslie again, and what a great presentation. I want to thank Cory and John and Mark for your wonderful insights here into what you do. And we have a number of questions coming in and some pre-submitted questions. So we'll start with that, and I'll just hand them over to whoever I think might be best to answer each question. And for listeners and watchers, if you do have a question, you can go down to the Q&A section here and type in your question, and then our colleagues will feed them along to us. But one question, Cory, I thought might be great for you that was pre-submitted is, how has nursing practice changed due to this global pandemic, if at all? And I can imagine it has. So, Cory, could you reflect on that a bit?
Hey, can you hear me? I was just taking myself off of mute. Great. So I think, thank you, Leslie, and thank you to everyone. I think that the foundational principles have always been there, and those underpinnings, as I was talking about, that compassionate patient care, the care coordination, the systems leaders and systems thinkers, and innovators and patient advocates. I think it's just really heightened right now due to this crisis and the need for all of these areas to really shine and be at the forefront. So I think those underpinnings have always been there, but I just think it's at a different level. And I think nurses are being, forced to one, be creative and work as a team, both amongst themselves and lean on each other. Certainly for the mental health support as well. I know it's certainly a challenging times for nurses and other healthcare workers during this time. And also there, I think of the unit that I worked on at Mass General for many, many years, and my colleagues there, and, it was a medical unit, and many of them are being asked to float to the ICU and take on new roles and level of nursing care. And so I think it's, nurses just jumping in where they're needed most, but that's always been what nurses do.
That's great. And I love one of these questions here that was submitted now. And Mark, actually, you were commenting on this in kind of our pre-conference about the importance of mental health. So Claire asks, might you reflect on the impact on nurses' mental health since they're so foundational to the public health system? How do you do it, and what mental health supports do you need?
I would say early on, I've been very thankful for the mental health team at Partners in Health. in Semi La Santé, because early on, that was the first discussion, is how do we support our team? Immediately, information was given on for mental health counseling, because they knew this is something, even though we didn't understand the full impact once you get into it, they knew that was something that we would need. I think right now we're starting to see it more. How do we deal with it is we talk about it. We ask them, are you okay? Let's debrief about what happened. Every death that happens, it's a person, not just a body. How do we debrief about that? And how do we talk about, because you fought for that life for so long, and that affects and that remains with them, because now you have become that person's family, where their family is not there. So you have become that person's family. Sorry, somebody's opening my, now you have become their only real life contact, and you have become their mental health counselor. Recently, our mental health team did a psychological first aid training with our clinicians to also help them, help our patients. And I think in one way, because you also have taken on the burden of the patients on you. We had patients that once they heard about their COVID status had tried to commit suicide, or and so now you have that, and they don't really have their family connection. So our team have asked, how do we respond to this, and how do we deal with this, knowing that this patient might actively try to commit suicide again? How do we talk this person out of the ledge? And at the same time, is how do you calm those fears within your own head? Because you still have that lingering in the back of your mind, you still have the fear of, am I okay? Is this cough just a regular cough, or is this cough something that I need to be worried about? And I think one of the big parts of is us not staying silent, is speaking to each other. And I think one thing that we could ask everybody to do is ask people, how are you? Like really want to ask, how are you doing?
Yeah, I think that's great, Mark, and I'm glad you got to speak to that. This next one, I think, John, you might be best suited to answer because it directly talks about the Massachusetts efforts, the Community Tracing Collaborative. So this is kind of a mashup of a couple different questions, actually. So, you know, how did you get this up off the ground with, you know, 1,000 contact tracers and care resource coordinators, you know, pretty quickly in Massachusetts? And how is that effort going with contact tracing here?
Yeah, great, thanks. This was an analogy that we used often during the early days of the Ebola response, and I'll use it again now, but we're still building the plane while we're taxiing down the runway. In fact, the plane has taken off and we're still tacking bits and pieces onto it. So it's a bit of a tricky endeavor, but the work is going well. So we've hired over 1,000 people. Those people are serving in 3 primary roles. The first is as case investigators. Those are the people who receive positive test results and check in with those COVID cases to see if they're doing okay, make sure that they have what they need to safely isolate, and that they understand what isolation is for COVID. And then talk to them about who they've been in contact with since you know, a couple of days before they got sick. The next group of people are our contact tracers. Those people receive the list of contacts and reach out to them and let those folks know that they've been in contact with somebody who's tested positive for COVID, that you know, give them instructions on how to safely quarantine and make sure they have what they need to safely quarantine, and they know where to go to get a test. And then the third group of people that we've hired is our care resource coordinators. And those people are helping connect anyone that we reach on the phone, whether a case or a contact, with resources that exist in their community that will help them be successful and stay well during their isolation and quarantine. To do that has been a massive, massive team effort. Taking people who are already working full-time jobs within PIH and elsewhere, and really leveraging their expertise as to how to get something like this up and running. And then having a bit of faith in the public health system, and really believing that this is the way forward. This is the way down the mountain. And, you know, it's led to a number of interesting and sometimes contentious conversations about, you know, maybe contact tracing is too big a project to take on, or we're too far away from the beginning of an epidemic. But what we saw in Ebola and what we've seen all around the world with all of our epidemics that we responded to is that this is the way down the mountain, right? A public health response that's founded on you know, nursing principles, and that's supporting a whole public health system is the only way to get to the bottom of it. And that means you know, continuing to fight and to be the voice on behalf of so many people around Massachusetts and around the world. So my hat's off to all the people working day and night to get this right, and all of the people. We've had over 40,000 people apply to be contact tracers or case investigators or resource coordinators in Massachusetts. People want to do this well, and they want to be a part of the solution, which is just incredible to see how many people are out there who really want to get to the bottom of it. So it's been amazing.
That's great. That's impressive that many people have tried to apply, and then it's really an outpouring of support for this effort. So thank you, John.
And I'll just add in really quickly. Sorry to interrupt, Leslie. I'll just add that we're digging into this contact tracing much deeper on a May 20th webinar. So I'll just throw that out there for everybody. We'll have time to really dig into what this is later this month. Sorry to interrupt.
No, that's okay, and I'm glad you plugged that because I was going to do it too. There's another one May 20th with Dr. John Welch and Dr. Megan Murray, who will be talking exactly about that. So definitely sign up for that. It's a COVID primer, I think, and how to stop the spread of the disease. So another question is kind of a mix of what was submitted beforehand and what I'm seeing coming through. But and Cory, maybe you can talk to this, and Marc as well afterwards. But you know, how are you able to navigate the COVID pandemic in terms of supplies and staff, PPE, everything that you need, kind of that 5S, that S's that we talk about at Partners in Health. Maybe Cory, if you don't mind talking kind of globally, and then maybe Marc about the situation in Haiti.
Sure, thanks, Leslie. You know, I think I have to give a huge shout out right now to our supply chain team, who has really been leading these efforts and making sure that we have the supplies and the PPE that we need across all of our sites. These have been some really challenging times, I think, to get a lot of the you know, medications, other supplies that we need not only for our COVID response, but for our day-to-day patient care. You know, certainly we have a large number of population that we treat, for example, for MDR TB and N95 masks being critical for that, not only for COVID response and a number of other things. And our supply chain team has really been working around the clock to find different vendors and emerging kind of creative solutions in order to best meet these needs. It has certainly been challenging. I would say the other thing that we've been working on is reaching out to different potential partners and groups who are working on creative solutions, and that's specifically to PPE of, you know, how do we extend the use of it or decontaminate, and what would work in our settings and context that is a little bit different than maybe the United States. But it's been a really big team effort on that. And Marc, I don't know, you probably have stuff to add from the Haiti side.
You really pretty much covered it. I think the big part is communication. On a daily basis, it's the numbers. How many do we have? How many do we need? Are you okay? How long will it last us? what do we do to prolong it? And we've had some very creative solutions proposed, some more creative than others. But I think that's for a book for us to write later on. But I think it goes to show, just going back to the whole, I love calling it the MacGyver spirit. You have everyone trying to figure out how can we extend it, because we are cognizant of the fact that we have limited PPE. We still have COVID, and we're still going to have to provide care. How do we extend that until we can, so that we're not putting ourselves or other patients at risk? But I think Cory really covered the majority of what it's a team effort, working together to make sure that we are covering our team as best as possible.
That's great. And I have to say, we have just an outpouring of questions and interest. So I know we can't get to everyone, just looking at the time, but I thought we could answer one more question. And this, it might be nice to chime in, each of you, honestly. There's a question: do you think that COVID-19 allows the authorities to see the importance of nursing and nurses? And Marc, you know, it reminds me of what you were talking about nobody looking at titles, but really the team. So what do you think, each of you, has this pandemic been, you know, is there a silver lining in any way for nurses and the nursing role? Whoever wants to jump in. I'm going to go to you, John. You're
All right. Thanks, Leslie. Yeah, you know, first of all, I appreciate the question. My guess is that it was asked by a nurse, because one of the you know, key spirit, part of the key spirit of being a nurse, I think, is trying to find that silver lining and trying to find what the ultimate benefit and lessons learned from any difficult experiences. You know, I have to say, in my work with the Commonwealth of Massachusetts, and this is working, you know, very, very closely with pretty high level folks, is that they have so much respect for the work that PIH does, and so much respect for you know, for the role that nurses play in that work. It's really amazing to see. And I think one of the things that we're trying to do at PIH, and maybe this will offer Cory an opportunity to answer as well, is to learn how an organization that's been based in Massachusetts for, you know, since our inception, but works overseas, how do we make sure we're linked to the nurses working right here in Massachusetts, and how are we staying really engaged with them? Because that will, it'll do two things. It will inform our work around the world, but also it will allow us to, and our global nurses, to inform the work here in Massachusetts. And my experience in that has only been that there's been really, really incredible respect for the work that we're doing, and for the role that nurses play in the COVID response. So, Cory, I don't know if you want to mention some of the stuff we're thinking about and talking about with our public health nurse colleagues.
Sure, John, thank you. Yeah, and I just have to echo, I think it's so great that the level of respect that nurses are certainly getting, and for the role, and I hope that's the silver lining. I hope there's many silver linings eventually, but what John's referring to is we're trying to start a local public health nursing advisory committee, where we can kind of turn to them as the local public health nursing experts during this time. And I think, you know, the public health infrastructure and system in the United States has really been something that has fallen away over the years. And I hope that this is a time that we recognize the need for that, and the role of public health nurses, both in Massachusetts and nationally. And so that we're recognizing not only the role kind of at at the hospital level, which I think is certainly being highlighted, but I also think this public health role for nursing, but just the general public health infrastructure should also be something that we continue to push far beyond COVID-19.
Marc, did you want to add anything, or are you good to go?
I'm good. I think they really covered it.
Great. Well, thanks to everyone. I know we're at time, a little bit past actually, but thank you especially to John and Cory and Marc for your really wonderful comments and taking the time in your very busy schedules, always, but especially at this moment. I also want to thank everyone who chimed in and watched and stuck with us, asked questions and made comments. This will be recorded. It is recorded, and the recording will be shared. So we will share that link following up, as well as the slides that were presented today. So if you wanted to, you can check that out at a future time or share with other people. Thank you for your support. If you are a supporter in any way, monetarily, volunteering, please go to our social media sites as well, Facebook and Twitter, Instagram, and LinkedIn. And you can always visit us at pih.org to check out news, information, and donate if you are so inclined. So thanks again, John, Cory, and Marc. And I hope we will see you all at the next webinar. I know John will be there because he's one of the presenters along with Dr. Megan Murray on May 20th at 3 p.m. So mark your calendars. Thanks everyone, and talk to you again soon. Bye.